I've been in private practice a little over 11 years now. A general cardiologist, even though I do interventional cardiology as well, but pretty much run the gamut when it comes to cardiology problems. I first heard about Genopath, I guess it's been 2 years now. Originally got interested in the whole field when I read an article Eric Topol authored on personalized medicine and just pharmacogenomics. And from that, then gradually got more interest in this area. Absolutely. I started to integrate them into my practice approximately 3 years ago. And it took a little time for it to change how I practice because just like anything, you get used to using it on a daily basis. But once I started to do that, I saw the value of it and how it really changed how I would treat the patients and then how they would feel. When I first looked at it, I didn't really understand cytochrome P450 at all, not in the way I needed to. And so by integrating that in a patient's chart now, especially with the electronic medical records, it's so simple. We can just interface easily, but it allowed for me to do a much better job from a comprehensive standpoint about how to manage their problems with the right medicine. There's one particular guy that we're having so much trouble with. He needed to be on a beta blocker because of his underlying chronic coronary disease, and I just remember him having so much trouble with so many medications. And this was when it was in its infancy when I started to use it, and I did the swab and found him to be a poor metabolizer to 2D6, and we changed him from metoprolol to atenolol, which doesn't go down the 2D6 pathway. And within about a month, he was calling saying he felt like a new man. And it wasn't even manifested in his blood pressure or his pulse. It was just purely on his overall general well-being and how much better he felt. That was really an impactful moment when that happened. Definitely, and they were reassuring and really kind of allayed a lot of the fears, particularly about the insurance. They had somebody in our office originally that did all the swabs and then was good about teaching the staff about how to do that. Now it's a seamless process. After 3 years, it's I can order and keep going on to the next patient. The turnover time is so much faster now than it used to be, and that allows for us to do a better job of taking care of patients. As far as the future goes in this landscape, I think there's so much potential, but just like anything, it just takes a little time to try and get people interested in it and realize the true value of it. In the grand scheme of it, I see this being a mainstream test because of its impact on how it can affect patients' lives and their morbidity and mortality on a daily basis.